Yemi Adaramodu. He gave the assurance in his country home, Ilawe Ekiti.
You can see that the president of Nigeria and then the Abuja, the FCT minister, they have been working seriously with the security operators of Nigeria to make sure that these dastardly occurrences do not happen anymore in Abuja especially. And then we could find out that just a few days ago, they have apprehended these criminals. And then a lot of catches had been made of them, and then it means that the security is up and doing now, and the senators, like any other resident of Abuja, we have very absolute and implicit confidence that Nigerian security is up to the game.
And in other development, the Nigeria Customs Sokoto Zamfara Area Command, in collaboration with the National Agency for Food, Drug Administration and Control, have destroyed unregistered foods and pharmaceutical items deemed unfit for consumption worth millions of naira. Speaking with journalists at the Kwanaya dump site in Sokoto State, the area controller of the Nigeria Customs Comptroller Musa Omali advised importers to always liaise with relevant agencies on the right items and ways to import them into the country. It describes smuggling as commercial fraud that is working against the economic growth and development of the country. Mr. Omali also expressed concern about the safety of Nigerians, as most of the items destroyed are capable of jeopardizing the health and well-being of citizens.
We want to use this opportunity to appeal to importers and exporters that they should desist from importing all this unwholesome product. The health hazard cannot be overemphasized. It's not good.
The management of NAFDAC is very grateful to the Nigerian Customs Service for the wonderful job they've been doing, and the other security agencies that have been collaborating with all the sister agencies to ensure that we safeguard the health of the nation by ensuring that only safe, efficacious, wholesome food and drug products are being sold in the markets in Nigeria.
Now let's talk health. Are you aware that cases of leprosy infection is still being recorded in Nigeria despite meeting the World Health Organization elimination target in the year 2000? Currently, the country records about 3,500 diagnoses annually. Our correspondent Chenemi Bami visited a leprosarium in Mina and has details in this report.
Today makes it a year and 2 days since Sani Sidi came here for treatment after he contracted leprosy. He said he has been provided free treatment, given free drugs and food all through his stay.
I'm very, very better because they told me yesterday, they said that I will go back on Monday. And I'm very, very well. They supply with medicine that I will go and use at home. Give me some food that I will go and chop at home. So I thank them very much.
Also known as Hansen's disease, HD, leprosy is an ancient chronic mycobacterial infectious disease that is associated with serious morbidity. Although curable, it continues to be a disease of public health concern because of the stigma associated with it. In Nigeria, leprosy is still prevalent and remains a significant public health concern, with over 3,500 new cases being diagnosed every year in the country. According to the Nigerian Center for Disease Control, 25% of the affected persons get irreversible deformities. This hospital, founded and funded by the Leprosy Mission Nigeria in the early 50s, is the only available center for treatment of leprosy in Niger State and supported by the government. As the world marks International Day for Leprosy, these volunteers gathered here to help the patients clean the environment.
Treatment is free and it is curable. Currently, we have 16 male patients and we have 7 women currently on admission. Some of them are just from Niger, but we have people from Ebonyi State, we have people from Adamawa State, we have people from Kebbi State who are currently on admission here.
When we came around, we noticed that the hospital where the patients are, it's looking very dirty and it's not convenient for them to live in a dirty place. And that was the reason why we decided to come out in our numbers to do the sanitation so that they can have an habitable please.
Leprosy disease usually occurs after prolonged contact with an infectious person. It is passed from person to person via droplets from the nose and mouth during close and frequent contact with someone with untreated leprosy.
Hospitals and settlements like this are the only hope for leprosy survivors. They need a lot of government support and attention to cater for the people here. Chanemi Bami, TVC News, Mina.
Now, providing staff with basic skills is one reliable method of boosting their performance and capacity for efficient service delivery. Now, that's according to the Chief Medical Director, University of Maiduguri, Ahmed Ahijo, who spoke at the training organized for staff of the hospital. TVC News' J.C. Tafida reports.
Since its inception in 1983, the University of Maiduguri Teaching Hospital has been able to maintain best standards in providing high-quality healthcare services to the nation. The hospital has 1,305 bed capacity, which enables it to provide medical care for patients with life-threatening illnesses, as well as those affected by the 13-year Boko Haram insurgency. Now, the hospital, in synergy with the Walton Center NHS Foundation Trust and the University of Liverpool, organize a training to boost capacity of its staff.
Continuous professional development is key to any success. If we really want to achieve much, then we have to give the skill that is desired to our own staff. So it's just part of the capacity building in stroke and neurosciences. As you know, stroke has a very high burden in the country, and we lack centers within that give treatment for emergency stroke. And our aim is to get the best to reduce the medical tourism outside the country.
These are people that have all the knowledge and the expertise that are required to set up a collaboration mechanism between the University of Maiduguri and the Welsh University.
Resource persons at the workshop believe that with world-class equipment put in place by the hospital, this training will ensure improved service delivery for patients.
Liverpool in the UK to work together and look at avenues for improving training, for research and for educational links between the two centres. There's so much potential here, and you've got so much equipment and enthusiasm. But I think there are parallels and things that we can do together.
I think the paradigm is shifting. I think you can see for yourself here in this institution that it's becoming the largest teaching hospital in the country, if not in the sub-Saharan Africa. Some of the stuff or the instrument that we have here, I think it's, it can rub shoulders with the one in Europe.
Some of the topics discussed include neurosurgery in the 21st century, the overview of stroke and its causes, neuro-oncology, and the role of interventional radiology in the management of stroke. Jessie Tafida, TVC News, Maiduguri.
While the Lagos State government, in partnership with Chinese consulate and Chinese community in Nigeria, funded 8 children to undergo cataract surgery. Inioluwa Popola has the details.
The faraway cries of a child means either he or she has just been born or wants something, but this is not the case here. About 8 children are being provided free cataract surgery at this general hospital in Lagos, spearheaded by the Lagos State Ministry of Health, the People's Republic of China in Lagos, and Chinese community in Nigeria. As they visit the children and their parents during surgery, they say this outreach targets low-income families and also restores sight back to these children.
Unfortunately, a lot of people live and die with those cataracts, not ever getting access to the simple-ish surgery that they require to be able to live normal, productive lives. And that is why outreaches like this are really good, because we are able to help people that otherwise might end up living their lives with this challenge.
We think with the help of the Lagos government and the Chinese consulate and the Chinese people and the Chinese association, they can get a better life. From this project, we think we can deepen and strengthen our friendship between Nigeria and China.
So last year we did 3 patients, and this time is 8. whatever we can do, and we will do more. This is, I present our Chinese community, and where we are taking this country as our home.
This is Romy Loye, a father of twin boys who were privileged to have gotten this free eye surgery. He narrates his experience, while Shaliwa says she has been living from hand to mouth, not having enough money to take her child to the hospital.
So they have cataract in both eyes, like this very one. So usually look not too, can't see well.
When I born my child, I noticed one white eyes and white things in her eyes. I meet Mrs. Dr. Daudu. Dr. Daudu say na cataract. Then we do the surgery. So I want cry. I dey cry that time. I cry. Say where I go see money to do that surgery. So I thank God to say then do the surgery.
This is an initiative to support the renewed hope agenda of President Bola Tinubu to target the nooks and crannies of the country, improve the healthcare system, and make it more accessible. Inyulua Bukola, TVC News, Lagos.